Dr.
Slide.
Pepe? You intend to stay
Yeah,
on?
I guess so. But where's the slide changer thing? Is the clicker? Is it all up there, or is there a clicker?
So since it's open like this,
Yeah.
the clicker doesn't actually work. We'll just click for you.
Okay. So what the plan is? I was talking to Tom and Meg. We're going to run through all the slides so they know the parameters of what we're going to do here. So let me just set the tone for what we do. Is you heard this morning how we did this, or this afternoon, how we did it, where we report back to the group kind of the conclusions. Just to give you an idea, remember, we're not here to change policy. Okay. Oh, me. Sorry, I got to record. They got to record me. That's right. So here's the point. Today, just be reiterative of what you heard before. We're not here to change the recommendations. We're here to say, how do we successfully get them done? What we're going to do is we can come up with 90 suggestions, and we'll take that down, we'll get them recorded, and we'll even make it part of a final report. What we want to report, though, for practical purposes here, to report back to the main group, we're going to come up with 3, maybe 4 key recommendations that we think are maybe low-hanging fruit, okay? Things that we can get done that we would prioritize to get the messaging done or whatever. What are the things that we want to say, hey, these are key things, this is what we all agree to, and let's get it done. It doesn't mean you can't make other suggestions. The other thing that will come up is that we want to do this in a way that we give the pros and cons, perhaps, of some of these things, and it may very well be that a key pro might be that it's low-hanging fruit, we can get it done. That'll be one of the other considerations. But as we do this, sort of as maybe you heard me say earlier before, that in the context, what's really important for this thing is what can we do that will be sustainable, okay? Because we can do this big flurry and big, whatever, a big campaign, even get money from some source, and then it goes away. So part of it is, what are the things that we could do that can be sustainable, that can change life-saving efforts, et cetera, that we have, okay? So that's sort of my context. So just for fun, so you know what we're going to do is we're going to run through the slideshow here, and then we'll go and start with the top slide again, just to see where we're going with all this. So if you don't mind, what was recommendation number 2, by the way, is regarding this issue that we're here. So why are we here? We're going to say, how do we implement recommendation number 2, which most of you should be familiar with here. But the main thing is, how do we get this whole thing going in terms of promoting public awareness of the signs and symptoms, et cetera, and creating a culture of action that prepares and motivates bystanders to respond immediately upon witnessing a cardiac arrest. Okay? Everybody feel pretty comfortable with that part? And we'll move on next. So we're going to talk about messages to communicate. One of the things you heard this morning was cardiac arrest is not a heart attack or other cardiac conditions. All loved ones in all age groups, we kind of even saw that in the things that should be considered at risk. Training and resuscitation performance affects chances that a person will survive, et cetera, et cetera. Okay, next. Mass media campaign, how do we reach these target audiences? Is it a mass media campaign? What's the strengths and weaknesses of that? Twitter and other social media, what are the strengths and weaknesses of that? Next. Targeting healthcare providers, in terms of the folks that we're going to try to reach, maybe how they get to their patients. And looking at patient survivor and advocates and networks, et cetera, how do we go approach these guys, and then strengths and weaknesses of that as well. Next. So the national strategy is to launch a coordinated public awareness efforts, how we coordinate that with groups linked to most at-risk populations, et cetera. Public-private partnerships to coordinate messaging and how to target it. And that's going to wrap up with the whole issue here long-term, is that we're trying to create a coordinated partnership that's going to get this done and make it sustainable. So that's the other overriding context in here besides sustainability. Next. And then looking at local strategies to sustain and capitalize public awareness, whether it's targeting vulnerable populations that we may not be reaching right now because of second language barriers, or poor neighborhoods, et cetera, and using church, social groups, targeted school systems, whatever. These are some of the suggestions. What else would you add in there, or are any of those priorities for us, or not such a priority for us? It doesn't mean we have to exclude these, and it doesn't mean we have to include these. Are these issues that we want to put on our list, and then what are the ones that what are the 3 or 4 take-home points that I'm going to deliver to the group as a whole when we get out of here, okay, or come back here. I guess we'll be in the same room, which is even makes it better. Okay, and you guys have priority seats. Look at this up front. It's good. All right, next. And that's it. So let's start at the top. So
Anybody need to read this recommendation through? Everybody feels pretty comfortable with that? I'll be glad to hold it, huh? Okay, let's go to the next slide then. Okay, so messages to communicate. So what do you think about this first thing about is this really an important thing? Bob seemed to emphasize it is, and why do you say that, Bob? Oh. Yeah, let's get your microphone for him, huh? What'd you say? Yeah. Okay. I just wanted to first get Bob's comment, then we'll go with you, Dr. Meyerberg, in a second, okay? Okay. Yeah. Go ahead. Bob, you want to
I had a knee replacement about
what was the
2
reason
months
for
ago, and I forgot my cane.
Yeah.
That's why I'm hobbling. So, yes, it's important.
Okay. All right. You want to articulate why real quickly? Yeah.
So the worst part, well, if you go back historically, the American Heart Association back in the 1980s did not use the word cardiac arrest in any of their public disclosures, advertising, or anything like that. There was a reason for that. There was an active decision. Cardiac arrest was a better way to die than cancer. That was one reason. The other reason, there was nothing you could do about it.
Yep.
That changed when Mike Weisfeld was president, and he got rid of that problem of them not talking about it. But what happened was that the public media then started talking. It isn't heart attack, it's massive heart attack, which implies non-survivability.
Yeah.
And it's extremely important that we get that point out to the media, because they're the ones that are talking about it, and they're the ones that are educating the public.
So there could be other things that people might call a heart attack, which could be my atrial fibrillation, or I had a whatever. Yeah, probably, yeah. You know what I'm saying? Besides the myocardial infarction, or ischemic event, or whatever, there could be other things that could go on. We're going to bring in a microphone. Bob, you're going to add anything to that because you made the point
From
today.
a communication standpoint, it's a tactical opportunity because it's kind of a new term for the public.
Okay.
It's sudden.
That's interesting.
Which gives urgency. Arrest. People get arrest.
Yeah.
It's unexpected. And it's also an opportunity for all of you all to engage the media, to make that call and offer that gentle correction.
So I would say that here is that cardiac arrest should be identified as a unique entity, okay, that's not a heart attack, or whatever. So that's kind of the messaging here that we're going to be giving and get that across as a specific entity. Do we have some more people here who got a microphone to get to them? Yes, go ahead, and then we'll go to you. Back there. Yeah, sure.
I'm a survivor of a heart attack and caused the sudden cardiac arrest.
Yes.
Caused by the heart attack. So when I tell my story 1,000 times, I explain that. So
Yeah.
I'm explaining the difference right off the bat. So it is important for me because it did save my heart physically. While it was vibrating, I was losing. And of course, my heart is 50% gone.
Yeah.
And so I got an 85% heart now, but it was in ventricular
So
fibrillation.
what if you think about the concept that we just don't say cardiac arrest, we say sudden cardiac arrest? Is that going to be helpful?
Yes.
Huh?
Yes.
Yeah, okay. It's sudden, because it's an unexpected event that could happen to anybody, anytime, anywhere, okay? Go ahead. Yes, Alan, did you want to say something? Or did I have this, then I have this other person on there?
Yes. So I'm struck by this summer, I've had, as far as I can count, 12 admissions to the PICU for near drownings.
Yeah.
All of whom got CPR at the
Right.
poolside. And we've had a number of children who were defibrillated. And it is striking how much that motivates people to get CPR. And when we were initially doing the advocacy in Annapolis to get the law for pool AEDs at the pool, people kept saying, well, children don't have VFib arrest, which of course they do. People don't drown due to VFib arrest, which of course they do. And then we would say, well, it doesn't matter, it could be grandma or it could be the kid. But it's striking to me how all of a sudden people are paying attention.
Right.
And I think it's another kind of motivating story, as you said, about different kinds of causes for sudden cardiac arrest.
Since I'm the moderator, I hate to give my own little, story, but one of the things whenever I do media things, everything is like, if we get these AEDs, is it true if we don't get these AEDs, many people are going to die? And I said, absolutely, if we get these things, many people live. It's always the glass is half full. In the case of kids, boy, do I appeal to fathers and others and mothers, a protective thing, like who would want to stand by and let their child die because they know, so that's where you could take. But that segues us into the second one, that all loved ones and all loved ones specifically, and all groups are at risk, whether it's older or younger, et cetera. Alan, you're going to say something, though? Were you going to say something? Or? And then Ben, okay, sure.
I just want to throw out that, all those things are good. They're all important. You can't have too much. You can't have all those messages, and they fall off at the bottom.
No, but I think the single message was we've heard today is sudden cardiac arrest is the term we will use, or is a unified term, is it right?
Well, I just want to say I'm not sure the top thing should be the whole thing about people don't know to say cardiac arrest versus heart attack. I almost don't care that much as long as they know what to do and they're willing to act. I don't think our chief messaging thing should be just you want people to know what to do. You want to know that they can save a life and they can't do it wrong.
All right, Alan Braslow. Let's see. Lay people know this is a heart attack. Why do we want to make it more complicated for them? Why don't we make it, I think you're saying, assessment-based? It's heart attack, they're talking to you. I don't say conscious because lay people don't know what that means. Heart attack, the guy's down or unconscious. So if you move it, because then it leads into the action I believe you're talking about. And to go against that, to teach cardiac arrest, I mean, the press is against you because you'll never re-educate them, and every night you see that. So just a thought, Paul.
Yeah. Yeah. Okay. You and then we're going to go over that way. We'll start packing the microphone over that way. Go ahead.
I think something that might be missing here, and I agree, Ben, which term sudden cardiac arrest, but the issue is it's survivable.
Mm-hmm.
We're not really saying that anywhere up here. We're saying training can affect survival.
Treatable.
Treatable. I can actually make a difference. We've just educated a lot of EMTs and paramedics that the historical is everyone dies. We've completely socialized the concept that that's not true.
Okay.
I think we have to do it on the public side as well.
So I think that, not to get too many words, as Ben was saying, we could say that it's a sudden death, sudden cardiac arrest, or whatever, but then the next line is that is treatable. And that would be a great example. Okay, go ahead.
Okay, so I think what I hear you saying and what I heard Ms. House saying is we need to back way up, and that is what's our model and what's our focus and single targeted message. We have said 10 things as we sat here today, and we're stuck on whether we say arrest, sudden, who cares?
Okay.
We need to have a targeted message. We all know what we're saying, train our advocates, and get good leaders, and decide who's going to send the message. We as a group can later hash down what we say in the message.
Right.
But we have to have a model moving forward. We don't have a model. We're like cats.
Okay, so what's your suggestion?
My suggestion is that we back up and we decide what our single focus and our
But what do you
targeted
say?
messages, develop the message, and then all of us stay on the freaking script.
But what's your suggestion for what that single? Yeah.
But one thing we can decide is who is the audience. So we're talking about the message. We need to think about the audience. And is the audience the person that we want to act? The recommendation, the last line of the recommendation was messaging that leads to action. So we're not talking to providers. We're not talking to victims. We're talking to bystanders. So does anyone disagree with that? If we're talking to lay public, I'm just Joe Blow, and then the message is you can save a life. And you can't do it wrong. The main thing is they don't want to hurt them. Right.
All right, let's pass that down to other folks here that were wanting to talk. Say something.
I have two. I just wanted to say that I respectfully disagree that we do need to call out sudden cardiac arrest, because part of the problem is that it's so fragmented with the messaging of, whether it's a heart attack or whether it's high blood pressure or this, sudden cardiac arrest has gotten lost. We know that. We've done research with the community, with consumers. It has gotten lost. People, when they understand the definition of sudden cardiac arrest, they are much more likely to take a CPR course and take action. And we know that. So I think that we have to define it in one simple message, what it is, and we all have to stick to that.
Sounds like there's an agreement on that. Yeah. Yeah. Correct. Okay, so let's go, and I'm going to wrap this up in about 2 minutes, this particular session, just so you know. So, because we got to get this particular concept, so we're going to get on to other things. Go ahead.
So as far as message to communicate, we need to look at barriers. And there's two major
Right.
barriers that are not up there. Number one, gentleman in the back there said it, you can't do it wrong. It's a liability
Right.
thing. The second one is no more mouth to mouth. People don't understand that. Those two things need to be included in any message that we communicate to the public.
Okay.
So,
Yeah, fear is the barrier, yeah.
right.
You could save a life.
But the two things that they're, I think, most afraid of are the fact that I might have to do mouth to mouth on somebody that I don't know. Or I'll do it wrong. Yeah.
So the message is sudden cardiac arrest could happen to anybody, but you can save a life. It's easy to perform, whatever, those, yeah, and that kind of thing. Go, I think, okay, so let's go on to this, and then let's,
All right,
I gotta wrap this up.
I'll be very quick,
Yeah.
Paul. So, having been doing this a long time, I'll say that collectively, as a group, we all suffer from the curse of knowledge, okay? So we try to convey messages that are too difficult for the general public to understand. It's got to be simple and straight and to the point. The recommendation of having a single message makes a lot of sense. But given the multiple organizations that are involved, and none of them enabling smaller local-based entities to kind of top and cap and bottom those messages with their own contact information, makes everyone competing to make a better message, and then the curse of knowledge strikes and it just becomes a mess. So a single message that everyone can use, but customized like with their own location, would make the greatest deal of sense, at least in my opinion.
Uniform definition.
Right, like, remember the sound bites that work that we
Yeah.
did for the mass CPR
Right.
week or whatever?
There's no way, we would say, there's no way a professional rescuer to get to you in the 4 or 5 minutes in which permanent brain damage can occur. It's up to you to save your loved one, kind of things like that, yeah.
It's a civic duty and moral
Yeah,
obligation.
right. But you're motivating because there's no way someone's going to, the helicopter's not going to come out of the sky and save you, that kind of thing, right? Okay. Yes, go ahead. Yeah? Drone, yeah, the drone might, that's right, good point. Then you and then Nisha, I'm going to wrap this up, go on to the next part. Okay, go ahead.
The research that we recently conducted, the national survey, consumer survey,
Yeah.
the conclusion was that creating a uniform definition of SCA in consumer-friendly language and using it consistently across organizations, the medical community, and the media is urgent and mandatory. This definition should distinguish between SCA and heart attack, since the blurring of the two terms may be contributing to unintentional consumer apathy with deadly consequences. An integrated strategic marketing, communications, and outreach plan at a national level is of highest importance.
Okay, great. So Nisha, and then we're going to probably, I want to go on to the next part because we have to get going through this, but go ahead. You were going to say something? By the way, I've made a big faux pas because we're recording this. Please tell us who you are, what organization you represent, and I apologize, okay? So go ahead.
Chandra Strobos, Johns Hopkins. No matter what age group you are, whether you are the Twitter generation or you are the non-Twitter generation, everything is sound bites.
What's Twitter?
So
Yeah.
I not only do I applaud the fact that the message has to be simple, it has to be very concise.
Yeah.
So if you say you can save a life, call and pump.
Yeah.
Okay? To have all of these are very laudable things to do. But you got to put your money down on the most important thing you want. You can build on that. You can build on that, but if we learn from the other more successful campaigns, I mean, breast cancer, not to say that I follow it, but what do they teach you? Early detection. They don't tell you, well, these are the data on chemo, this is what radiation does, or lumpectomy, early detection.
All right. Okay, I'll take one more, but then I want to get onto this next section here, so go ahead.
Martha Lopez Anderson, Parent Heart Watch. I think something that's lacking is what sudden cardiac arrest looks like.
Yeah.
So collapse and unresponsive. I mean, we need to keep the message simple, stupid, but we need to let people know what cardiac arrest looks like when it happens. And then, you know, like you said, call 911, start CPR, or push hard and fast. Simple steps. We
Sure.
can get into the other stuff about cardiac arrest and heart attack down the road.
Go ahead. Yeah.
Very similar to what Martha said. The way I try to explain it to friends, lay friends, not medical friends, is that you can survive a heart attack, your heart can continue to beat. You cannot survive a cardiac arrest if there isn't intervention. So it's crystal clear at that point. You have to have CPR, and it would be very good to have an AED.
Yeah. So part of it might be that, you know, millions of people died needlessly because their loved ones didn't know how to do CPR. Some message simple as that. Okay. All right, and then just the next line is just repeating pretty much what you said, which is I think one of the things we should target, I think, in message that could happen to anybody at any age. It's not a disease of the elderly, that it could happen. In fact, the persons you're most apt to say, I mean, where it's really useful, obviously, is in the case of drowning, because if they get bystander CPR, they're apt to you know, respond in those circumstances. So, yes, go ahead.
Can we put the top line message at the top?
The top line message at the top.
You can save a life, be ready to act, or something like that?
Okay, say that again, just Bob, so I just want to make sure I understood what you were trying to say.
The first bullet, it seems like should be the top line message.
Okay.
You can save a life, be ready to act, or whatever we agree that the little tweet size message is. But if we want to lead to action, it sounds like somebody over here said, you can save a life. That's...
Yeah. Okay, so you're just prioritizing the message that saving a life is easy, or something like that, along those lines, right?
Well,
Is
I'm
a sort of a...
also trying to determine if we can come up with one message that everyone in every different silo agrees upon.
Okay.
That's going to take some time.
Well, who disagrees with that? You can save a life, be ready to act.
Two words you can also use is conscious and unconscious.
Okay. And that's probably my situation tonight, so we'll see. All right. So, all right, let's go on. So, going down all loved ones and age group, that's part of the marketing eventually. This doesn't have to be the message you set on a bulletin or a piece of paper. Part of this is how we actually, it's useful for us to market to other people, and then we have to select the targeted people to go through. But this is an important thing to know, that it could happen to anybody at any time. Yeah. Yeah. Okay, got it. Oh, we lose the page. Okay. What happened to the bottom part that was here? Oh, okay, got it. Training. Yeah. Okay, got it. Give me another. So I think that one message about the AEDs, about you need to know where it is, because that's where the biggest screw-ups occur all the time, is that people don't know they're right there. So that's part of the training that I do nowadays. My messaging is usually like, okay, choking, pop the cork, and I make them repeat that too. What do you need to know about AEDs? And they have to repeat to me that, know where it is, go get it and turn it on. And that's basically it. But that's part of the problem, I think, is that's been one of the obstacles and hurdles has been to saving lives, is people not knowing where the AEDs are.
Most people don't know what an AED is. Most people don't know what an AED is.
Yeah.
And that's my big, one of my suggestions is stop using the acronyms.
Do we say defibrillator?
Absolutely.
Yes, okay. I kind of agree with that. So you don't use AED, use a defibrillator. Yeah. Because people know about the defibrillator.
I don't even know what that is, but it's,
yeah. Defibrillator. Say again? Yeah. Yeah. Is a sort of, because they are pretty much one of the most fail-safe things we have in medicine. It's unbelievable. So that's a great message to communicate, that anybody can use them, and they're the most the safest thing you can use. Yeah.
And the cabinets bear the verbiage that says
only
used
trained
by trained personnel.
Yeah, that's kind of an interesting point.
Here.
Yeah. Is that because there are state laws that say that, or? Huh? Yeah. So that's what I'm saying. That's good. So that might be one of our things we recommend that we remove that. Yeah.
When we changed the 2010 guidelines to take out the language, when people say it would be good to be trained, which of course it would be, the implication was that you would be sued if you weren't trained.
Yeah.
That's why they put that on the cabinet.
Yeah.
And we're now requiring that people, when they buy them, that they even buy them without that because they're still for sale.
Yeah. So know where the defibrillator is, I think, is a great message. You know, so I can think of my own environment. I'll be teaching, like I said before, at the city council, and one of the first things I said, where are the defibrillators here? And then someone goes, they go, they're all by the red elevators, right? And I go, that's right. It's by, can everybody tell me and repeat that? So that's an important message, I think, because if someone went down, they said, go get a defibrillator, you know. So part of the messaging or training eventually should be, who knows where the defibrillators are? Go get it, you know, that kind of thing. So, all right, yes.
The last time I looked at the medical legal aspect of this,
Yeah.
uniformly physicians were protected by Good Samaritan laws in terms of acting for any medical emergency. Yeah. This was not true for trained versus untrained lay people. So certain states, trained lay people were not protected by Good Samaritan. Untrained were. Now, I know there were movements to change those laws. I don't know if they changed or not, but if not, that's a big disincentive.
Actually the opposite.
No.
Within your level, within training, protection of
Not Good Samaritan.
Massachusetts for the longest time, if you were a trained professional, you were not covered by Good Samaritan laws. Hey, incriminate yourself. I thought it changed, but well, when was that? Like 5 years, 10 years ago.
One of the things I want to do is where it says AEDs, change that to defibrillator. I think that's one of the key things I heard today. Okay? Where it says AEDs, say defibrillators, then that'd be good. And you can say automatic defibrillators, I don't care, but I think the key, yeah, just.
All signage, you know,
Yeah.
also AED.
Yeah.
I think we need to test those messages. Because
Yes, agreed, without question.
Yeah. So that's a great caveat about all this. That's good. But I think what we're trying to do is we're trying to use your brain trust here to sort of create the general concept, get a general feel. And it sounds like something like, one of the things I heard very loud and clear is like maybe AEDs shouldn't be AEDs. Maybe they should be, you know, automated defibrillators. Everybody kind of knows that. Mary, go ahead.
There might be someone else here that would know more about this than I do, but I know that the Cardiac Arrest Survival Act was reintroduced again by the senator in Texas, whose name I'm forgetting. But anyway, it would make provide liability protection for anybody who gives CPR.
In a state that didn't have a supportive Good Samaritan law, the CASA would support it.
Okay. So let's, if you don't mind, let's drive on to the next slide, okay? Because we got to get through this whole thing. But go ahead. What do you want to say before he's like?
Just one other message. I don't know where it fits, but when tested, one thing that was very effective at motivating people to learn CPR was that the knowledge that immediate CPR can double or triple the chance for survival. So I think it's you can save a life, and here's the evidence for it.
Right. Okay. Okay, so let's see, next. Now, so what are some of the other targets and what have been the hurdles? So, for example, we get here, we just talked about some messaging, and those are just some suggestions we're going to bring forth, et cetera, and I think I can probably assimilate a little bit of what, you know, relatively speaking, some of what we heard just now. But let's go on and say, if we're going to go out and start this messaging, who are the target audiences? And you saw the list of things here that we are going to do. So we're going to look at the general public at the national, local level, et cetera. What are the strengths and weaknesses? So it sounds like the hurdles have been, our messages have not been simple, and our messages haven't conveyed the simple message that it's easy and anybody can learn it. Those are the kind of things I heard. And haven't been consistent. So that's part of the message that we're going to try to create this consistency here. Okay? So the strengths of this is that those are the people we want to get to, right? But the problem is it's probably falls on deaf ears because how do you get this message to people? You're going to tweet everybody or have a famous person tweet them or put it on somebody's Facebook or, yes, go ahead.
Well, I mean, the advantage of a TV audience, if you target it correctly, is a huge audience. And as I've been standing here, we have 2 events coming up this year, in which there probably is going to be a large or huge TV audience. One in November and one in February. One in November, families may really need to know it. There may be a lot of cardiac arrests that night.
Yeah, as people
Either
are
way.
moving to another country or.
That's exactly true. Yes, yes. I actually watched that game one time with a bunch of, we didn't have any cardiac arrests that night, but I think it was almost close. But I'm sitting here thinking that, you know, the Sudden Cardiac Arrest Foundation has, you know, it's probably too long for national TV. You probably can't afford it. But that's a quick way to do one of these short, I hate to say this, but the University of Michigan and Bob Newmar, they have a great one. As long as they don't play that Big Blue in the background, it's great. But and that could easily be quickly made into a commercial that we could put on it.
I guess the question is, do they work? Do they actually promote change? Does a mass 30-second ad during a Super Bowl or RNC or DM, will it move the needle at all? Does it actually affect awareness? I don't know the evidence.
And one of the problems is, I think, I mean, you could put a commercial, it could be expensive, but if you're trying to get a message out, as Bob said, alluded to, is that part of the problem of the public witness or using the media to date has been that it's not news. It's like, oh yeah, we know about the CPR thing, you know, whatever, and then it dies and it's not sustainable. So,
Can I jump in here for 1 second?
Sure.
I think one thought is there's short-term strategy and there's long-term.
Brian, by the way, please tell us who you are.
Brian
and where you
McNally,
came from.
Emory University emergency physician, work with the CARES project. I think there's long-term and short-term strategy, and these ideas of doing a PSA, getting to a target audience makes sense, but a lot of these are all educational issues, right? Don't know what an AED is, don't know what cardiac arrest is, don't know how to do CPR, and I think if we look at examples of our Japanese colleagues that teach CPR almost 3 times in school at a much younger age, and they look at it as a lifelong skill, so you've got it reinforced. So I think a long-term strategy would be looking at, how do you incorporate this into the life cycle of education for a 20-year plan so that people know about this? Because I think the challenge is it's not simple to teach somebody at 20 years of age.
And I think that was the thinking process in the North Catholic, North Pittsburgh, Catholic schools where they had their peer group, like the seniors, teaching the 13 or 14-year-olds because it became a cool thing. But then they came around, they had them teaching, so they're reinforcing it that way. So I like what you're saying there. But let's get off the mass media campaign. The mass media campaign is that it's probably not sustainable, but I think it's still worth trying, and coming up with creative ways to make it happen with really good commercials like you just talked about may be helpful, but trying to get it out there is another deal.
I mean, I just add real quick that seatbelts, seatbelts in schools and anti-smoking was children learning it and teaching their parents.
Oh yeah, and my 3-year-old saying
I think
to
that's
me,
the issue. You got
Daddy,
to teach
put your
this
seatbelt
sooner,
on. Yeah, that's
and
a
you
good
have to
point.
sustain it.
Yeah. You and then go ahead. Yeah.
Okay, Jennifer Chapp from Stratoverve. One way to look at the media is not just advertising. It is to do a media tour, to do something to educate the media. They go on, they have conferences every year. Why don't we do something in tandem with their conferences so that they're educated?
Right. Would that have worked for you, Bob, when you were doing it?
Not as much as the cat story.
All right, Alan. That's good, Alan, though. That's good, because I want to move this along here, so thank you.
Yeah, Alan Braslow. To ditto.
Who do you represent, Alan?
Today?
Yeah.
Systems Wisdom associated with University of Pennsylvania.
Cool. Okay, thanks, Alan.
What does that mean? That's another talk. I ditto what you say. All these are testable. They're subject to being tested because for all we know, these are psychological interventions and they could scare the heck out of people. You never know. I mean, just like when we saw the beautiful work that Mary Newman and her group did, that was great for us, but who are we? I think that was brought up. So, all these things need to be evaluated, and it isn't, with a measurable objective, do they act? And you can test this through different iterations.
All right. So moving on to that, next thing is that, so the bottom line is that this is probably part of our portfolio, but the real weakness is that it just doesn't stick often, or people ignore it, or whatever it might be. And we've got to figure out better ways that are more sustainable, like you said, the school system things or whatever. Okay, how about Twitter? Can I get down to here and say, going into the Twitter area and the new generation? Yes, go ahead, Nisha. What's the strength? We're trying. What's the hurdles here, and what are the strengths and weaknesses?
So related to Twitter, social media, and target audience and how to reach them, I'm going to put in a plea that to remember that there is a huge population that Clyde Yancey and Marina will always point out, who our standard message, we have data that shows it doesn't penetrate. So we need to be able to target the minority populations with a message that they can embrace as well. If we can come up with a message that is uniform, that is great. Otherwise, we need to be more inclusive in whatever message we put out.
Okay. So that, I mean, that's just a generic statement, yeah.
It's not only just minorities, it's women as well.
Yeah, right. Or younger people, or whomever, you know, that kind of thing. Yeah, yeah. Okay, but how about now dealing with the social media aspects? Is that a good tool? Is it, you think it's worthwhile, or is there, what's the problems there? Is there limitations to it? Go ahead, and then we'll get to you. Okay.
Okay, absolutely. I mean, one of the benchmarks is the ALS Ice Bucket Challenge is a great example.
Right. Okay. And if we can get someone to go viral with something, it might be something that'll work very well. So this may be us adapting and learning that there's a new mechanism to get information to people. And that, we got to study that one too, and that would be really good. Oh, here first.
I personally think it's key. I'm pretty, yeah, it's absolutely key because number one, I think Robert mentioned it this morning before I could, it's a gateway into mass media campaigns. I have made a number of personal contacts within the media through social media, and it's a great way to feed them information and, get in touch with them and build those relationships. It's also a great way to actually brand your own message instead of having mass media brand it for you.
Right.
As far as weaknesses go, I don't think an overabundance of people within the industry really understand it fully, number one.
Yeah.
And number two, you need to be careful with your message because if you stumble, you will be crushed.
Or if you say the wrong thing and gets bad information.
That's what I mean.
Terrible.
Yeah, I mean,
All right, so one of the big messages that we need to mutate or die. It's new generation, new way people receive information, and those are our targets for the future anyways, okay? Was there anybody else that wanted to mention that? So that's what the take-home is, except that, and then to reiterate, the weakness is that you really got to get it right or it could really screw things up, right? And, all right, I'm trying to think of a better way to articulate that, but.
And also just generalized understanding of it, I think, is a big one. Generalized understanding of it, how to use it in its full capabilities. I don't think it's fully understood.
Okay.
Includes feeding the beast.
Yeah.
You got to continually feed the beast?
You absolutely do.
Okay. All right, once again, then we'll go to the next area.
I would add to the gateway to other medias, it's a gateway directly to the consumer. It's the most direct messaging tool to consumers.
So one of the things I'm going to come out of here today with is the big message that we've got to learn how to use this effectively and do that. Vina, you wanted to say something, and then I'll go down here.
University of Pennsylvania. I think for both mass media and Twitter, having celebrity spokespersons, people that will be important.
Right, so you get what's that guy Donald Trump say? Yeah, no, I'm just kidding. Because they're always, but the media, they say he tweeted today about this. Yeah, so if you can get something that said that Madonna tweeted today and said whatever, or let's take a better group example. Yeah.
Have Taylor Swift.
Yeah, Taylor Swift would be great. I'll talk to her next week. Okay. All right.
All of this is right. This is all right. And this is all correct.
Okay.
But it goes to the point that this needs to be a professional effort. This is a costly professional effort that we can't work out in this room. We're all very brilliant, smart, wonderful, terrific people, but this is for a campaign.
Okay, Terry, who are you and where are you from?
Perry Vandenhoek, University of Illinois. So we are working hard to try to do this in Illinois, and I want to reiterate something someone else said, that it's critical that you create some level of sustainability in the messaging that you're putting out there.
Yeah.
And to do that, you really need to partner with people. One strategy that...
When you say partner with people, whom?
Well, like a lot of kids
Yeah.
who actually know how to use Twitter. So you go into the schools and you talk to them about what's going on in their community.
Yeah.
Using data that, I mean, when you walk into a community that has really low bystander CPR rates, thanks to the CARES database, you can walk into those communities and you can partner with the kids in those schools, with churches. We're thinking about like partnering with the librarians because they have internet access that some people don't have, and so
it might be a thing in that area. You say that, and we, especially if we're armed with data, like you were saying, if you have the data, say the chances of you surviving, cardiac arrest, sudden cardiac arrest in your neighborhood or drowning is much lower than any others. But you can change that or something that's a motivator. Okay.
Yep.
Okay. Okay.
So.
Yeah. Go ahead.
I'm probably going to commit heresy here right now, but it's not the first time. And he's a bad influence. We're both pointing at one another. But, hey, a lot of smart people in the room here. If we look at the amount of money that's been spent and put and focused on training citizens over the span of several decades, and we look at that line escalating higher and higher, and then we look at the number of people trained kind of trajecting in the same direction, and then we look at the bystander CPR rate. The bystander CPR rate is flat. And at least based on what I know, which is very little, I'm a very simple-minded person, but bystander CPR rates do not significantly increase until there's an aggressive telecommunicator on the phone telling the person that they're going to do CPR. Yeah. So I like to think of this messaging not necessarily at driving people towards training, but a culture of support and willingness to help others in their ultimate time of need. And I'll shut up there before I get into any more
All right, so we're going to go to the next slide set, okay, just to move this along. Next thing they said is, how about healthcare providers? Is that an important target? Is that an important area where we go to? For example, let's say someone went in, their husband got evaluated for a heart attack or possible coronary disease, but they said, boy, if the doctor had told me to learn CPR, I would have learned it, or whatever, those kinds of things. Or maybe if there are people like we think about in our waiting room, they're sitting around waiting around, but if they could have a CPR thing, hey, it's easy, and you just show them. Take advantage of the healthcare environment where we have some control and do that. So those are some thoughts that I just wanted to sort of get you guys trickling out with about this, all right? Go ahead.
My name is Michelle Gossip. I am from UCL. One of the areas that we have discussed is making this as a part of our discharge process for any of our patients in cardiology as a pilot, and then working from there into some of our other service lines for
How do you tell them that without it being frightening?
I'm sorry, say that again.
How do you tell them that without that being frightening, or just say this is routine?
Well, I currently am focused on our cardiac arrest population, which I already have a relationship
Sure,
with.
okay, that's straightforward.
And so I've already established that comfortable relationship with them, and they see the value in learning this valuable skill before they're discharged home. Obviously, and oftentimes this is what saved their life to get into the hospital to begin with, so they're invested in that. And the other population that we are talking about branching out to is our STEMI population. Obviously, piloting the STEMI population.
Well, how about reaching out to like the pediatric population? They're just doing a routine thing.
Well, absolutely. I mean, for us, we're just piloting this process.
The American Academy of Pediatrics recommends that all parents are taught CPR before their baby leaves the hospital. I'm not certain that that's done, but there are several hospitals. Some have published it, some are just doing it, where high-risk populations are taught CPR. And if they ask, it's far more frightening to have to stand there and not know what to do than to be told this could happen.
And so we require vaccinations. Why can't we require this intervention that may work better than the flu vaccine? So, okay. Any other thoughts about where we could take advantage of this with healthcare workers then? But I think those are worth at least bringing up here. We'll say, yes, go ahead.
Paul, has there ever been, or can anyone recall whether there's ever been any study of people who have intervened, had exposure to CPR, and have decided to get involved and intervene so we can understand what motivates someone and what are the characteristics of the person most likely
Yeah.
to intervene? It's a lot easier to target them than to target 300 million people.
Well, it's interesting because, I mean, I just did my own study 15 years ago. Like, when we looked at people who were in the emergency department or were coming in for possible chest pain or whatever, we said, have you ever been told, that those important to learn CPR? It was just a sort of a standard survey and all that. And they said, the doctor never told us that was important. I would have learned it if he told me to do that. Those are the kind of things that I think I've learned. I don't know if that's universally applicable, but that's one of the things. Maybe I didn't understand your question totally, Ward, but is there anything else you'd add?
If I'm marketing something, one of the tenets of marketing is to target someone who's likely to buy it, right?
Yeah.
So selling baby marriages to NRA members is probably not a good target audience. So I'm asking the question, have we ever looked at what the target might be, so that we're not trying to sell to everybody, but to sell to people most likely to perform?
I see, the people who might perform it. Okay.
Right. In other words, if you went back and looked at people who have intervened in a cardiac arrest, what is the common denominator?
So here's the deal. My personal bias would be to target everybody, but I think you're right. You want to find out who your priority is when you do this, and by targeting, find those targeted audiences. So do you take the wives of 40-year-old men, or do you take, I don't know. I mean, how would you do it? What are you targeting? What would you think?
Every Rotarian or,
okay.
Lions Club member or something.
Yeah. Okay.
But to that point, I'm sorry.
Yeah, go ahead.
You were talking about healthcare providers, and what's always a little surprising to me is even ICU nurses who certainly know how to do CPR and did it last week will tell me, they'll say, Betsy, this person collapsed in the grocery store and I almost didn't do anything, and then I heard your voice and went over and did CPR. And it makes me realize that somehow they need motivation and confidence to do it in a setting that they're not used to. And so there is that element.
Okay. So you're saying we should talk to all our healthcare people and say, hey, nowadays it's real easy, just do the chest compressions, and do you want to do, we can do a rewrite of a course again for you, or if you want, to help you empower you. So, okay.
Isn't that what a targeted message does? It is applicable to all audiences. I agree. You start with the target or the slogan to, not anti-gun person, but targeted message use the same words, and then it doesn't matter where we put the message. We can prioritize where we put the message, but the words stay the same.
I just want to make sure I understand what you're saying. When you're saying targeted message, are you saying that you're targeting certain groups or targeting?
I'm saying we pick the same words and say them over and over and over again.
Okay, yeah, okay, got it. Yeah, only I can prevent cardiac deaths, right? Okay, so Smokey. All right, go ahead.
One important statistic is that 70 to 80% of sudden cardiac arrests happen in the home.
Right.
So, and that's a very compelling message, because when people understand that, wow, it could happen to anybody in my home at any age.
Right.
They're very
Yeah, in the general reply, I usually have like a media essays, whatever it is. Yeah, 70-80% of the cases that require CPR occur in around the home, and 10 or 15% of the workplace. It's going to be someone you know or love you're going to save. Those kinds of messages like that. Okay, but in the healthcare profession, you feel like it's kind of your obligation that we're trying to hear. So let's want to move on down here to the STEMI and survivor advocates issue here. What are the strengths and weaknesses of going that route? And we have some people in the room that are part of that. Okay, what do you think? What's your strengths and weaknesses? For example.
Well, I think putting a face to the condition of cardiac arrest is key. So when you see real people that have been affected by a sudden cardiac arrest, that can be very compelling.
All right, so bring in, you want to go ahead? So what we're hearing is, what you're saying is bring in really good examples, the real people who have had a cardiac arrest and all that. And interestingly enough, one of the things I found has been exceptionally helpful there is actually bringing in the person that witnessed it and went through it. Because the person who has a cardiac arrest oftentimes doesn't remember a thing. They just go unconscious. They don't remember. They're not connected. Whereas this is a deep emotional and an important thing to the loved one who witnessed it or had to go through it. So for bringing them both in is really important, I think, oftentimes. But But that's, so your thing, so the weakness is it doesn't work unless you're really putting a face to it, is what kind of you're saying, correct?
Well, I mean, I think it's I think it's a strength to, is this on?
Nobody looks good.
Yeah. Well, the other thing is that, you know, is like if anytime you're dealing with the news media, they're going to say, do you have any people who went through this?
Right, right.
So part of, I think we really need to create that network.
We actually have an online community of survivors, and we ask people when they sign up if they'd be willing to talk to the media, because we
Right.
get a lot of requests from media. So one thing we can do is reach out. You have a child in Tennessee who's a survivor or
Yes.
something like that. So that's one of the things that we try to do. But I think putting a human face on the condition is the thing that's going to make the difference. And
So it might be important to us to create a network of such things. Okay, go ahead.
Can I use this? Can you hear me?
Just tell us who you are and where you're from. That's it.
I'm Rick Chapp. I'm a SCA survivor.
Okay.
And I'm representing Buddy CPR.
Okay,
today.
got it.
I think, and Joanne from the breast cancer, she nailed it. She said that survivors are the lifeblood of that organization. They're the drivers. And I would agree with her and say that survivors are the main reason that everybody in this room is here today. Without any survivors, there would be no reason for us to be here.
So that's another reason for us to increase the survival rate so we can have more survivors to tell you how to.
Well, and in addition, from the research project that we did, Strataverve, I'm also, Strataverve is part of my company, or I'm part of that company. We found that that the lay people, general population, are motivated more by stories, motivated to learn CPR by the stories of survivors. It's survivors that go that motivate them to learn and to, you know, it just makes that human connection that in their minds that this is a valuable thing to learn.
Since I need to wrap this up in about 5 or 6 minutes, I want to go on to the next slide, but I think I got the message there. Clearly, we've got to get more faces, create a network where we can have willing subjects that could help us with that. Okay? What's on the next thing? What's the next slide? Can you go over to the next slide then? National strategy to launch a coordinate with organizations linked to most at-risk populations. So what do you think about that? Is this useful? Has there been anybody experience? Has that been a helpful approach? What's the strengths and weaknesses of going to AARP or whomever, you know, that kind of thing? Should you go to the National Drowning Alliance organization, or, you know, because you have parents who lost their kids or whatever? Is that useful or not one of the top? I mean, it could be part of it. Is it one of the stronger things or not? Yes?
Certainly locally it was. We've had foundations, you know, a certain child who died and the parents then donated the money back to these foundations. And in the state of Maryland, that's been particularly effective, you know, based on, you know, a different campaign that everybody recognized their name.
And the big question, though, is this sustainable? So you have a kid die, we get donations, give blood, you know, when there's trauma or whatever, but is this sustainable?
And I think that's where you have to bring it back again, another life saved.
Okay. Yes.
Every time we have another AED used at school, we advertise it, and, you know, that spreads them attention.
Yeah. So in this next thing, it says public and private partnerships to coordinate messaging and how to target audiences. I'm not sure what they were referring to when they put this up here. Does anybody have any insight into what that might be or how that works? Go ahead.
Most of the health-related national marketing is done by the National Safety Council.
Yeah.
So the National Safety Council should be integrated into this section.
Okay.
And they can deliver the message that we want them to deliver, depending on what that message is. But that's the vehicle.
So is there any other organization besides the National Safety Council that we bring in terms of when it says a private-public partnership, and is this high on the list for us? Go ahead.
And Jonathan Epstein from the Red Cross, so certainly Heart Association, Red Cross, I mean, all the typical alphabet soup organizations, I think, are where a lot of these partnerships have existed in different projects.
Yeah.
A sustainable national project over a multitude of years is probably something that hasn't happened.
Yeah.
But certainly short-term projects are fairly common.
Yeah.
We're doing one right now at Red Cross with us, and it's on drowning. It's a centennial campaign in 50 cities around the country with high drowning rates to change the curve, and it's being very successful right now. But there are partnerships out there.
Okay, so what we're saying is it really is, this is multifaceted and everything we can do helps and all that. So what I'm going to try to do, I want to take your 2 comments over there. Then what I want to do is how many other slides do we have here? Do you know? Is this it? Okay. Because then what I want to do is prioritize these things in terms of the messages I take back to everybody. I already think I know what I'm going to say, but go ahead. Yes.
Paul, I mean, one example of a public-private partnership is the PCORI projects, Patient-Centered Outcome Research Institute, and that actually has built out a large electronic health record coordinated system of care. That's its design for comparative effectiveness research, but it could also build in messaging components through a portal. So that's something I would really.
Is there a limitation to it? Yeah. Okay.
But it reaches out to a lot of people.
Okay.
Andrew McPherson. I'm an EMS and emergency physician from Victoria, Canada, representing the Red Cross. I think this piece is trying to get buy-in from another private partner that has huge exposure. This is the NFL wearing pink.
Okay.
What's our piece?
Yeah, yeah.
What's that part that will move our message forward?
Okay, great. NFL wearing pink is a good line. All right. Go ahead, and then I'm going to switch to the last slide so we can get through this, okay? So.
Just to add to his point, that's exactly, we need to go to the people that already spend. We need to go to the corporate entities, the private sector entities that already spend tons of money and have them partner with them, because many of them have missions and they have foundations to do things like this, and to help them understand the huge number of people that are perishing because of this, and that they can be, to your point back there, every time a life is saved by an AED or something, they get mentioned because they have contributed to the awareness messaging. So that's what's in it for them, is to be a good guy and be part of the solution.
Yeah. All right, what's the last slide so I can get through this part? So, okay. Local strategies to sustain and capitalize public awareness, target vulnerable population. I think we kind of said that earlier before, right? And I think there are values. I think we should say there's value for churches. So where people are, instead of a Tupperware party, you could have a CPR party or whatever it may be. But are these sustainable? Are these hard targets, or is it just another part of the compendium that we have our portfolio? Okay. And so I think that I got the general idea. So going back from what you meant, I could run through all my slides here, but if you're to do this, this is what I think the 3 or 4 messages I'm going to take back, and correct me if I'm wrong, is that what I've heard is that we have to give a very singular, consistent, targeted message, such as sudden cardiac arrest. Make sure we emphasize in that as a sub-theme that it's easy to do, it's treatable, and just make it as simple as possible in as few words as possible. That's a concise thing, and we have to agree upon that, which we can. Maybe that's part of the whole end point here is the collaborative, okay? We'll get there and help decide that final message, and that everybody adopts and takes it and uses it in a targeted fashion. Does that sound pretty reasonable so far? Anybody want to modify what I just said? Second message is that there are subcomponents in here, such as making sure people know how easy it is to use a defibrillator versus an AED, right? And that it's simple, anybody can use it, and that's sort of a sub-theme there that can be put on. I always thought of AEDs as being part of CPR, but just in case, maybe we do need to sort of specify know in the secondary message, know where it is, okay? And basically, don't be afraid to use it. That's it. So 90% of this is that it sounds like don't be afraid to do this, just do it, as some of my colleagues have said over the years. And I remember one time after our 2 city council members stayed live, one of the persons said, to the media, said, I just remember Dr. Pepe saying, just do it. And so maybe what you're saying here is that's right, just encourage people to get it done, and that might be where it goes. And then the other thing I think that, go on to the next slide, I think is that there are national media campaigns, or so on, But it sounds like one of the most effective things we have to do is sort of mutate and die in terms of going into the next generation. And using social media may be one of the strongest messages I heard here today, and we need to learn more about how to use it and how to get it across. Bob?
I think we should change the title there. Those aren't audiences, those are communication channels and how to use them.
Okay, got it. So let's say media, okay. Channels?
Communication channels and how to use them.
Communication channels. Okay, nice. Okay. Good. And then, so it sounds like the one things I would emphasize then, just besides what I just said, blah, 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 easy, blah, 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 and then get down to saying one of the things that all these things are good, public media campaigns using these things are important, both at the local and national level, and there may be various, but the big thing is that what we think that we really need to do, and there was a pretty large consensus that adapting ourselves, learning how to use social media and doing that, and doing it right was one of the important messages that I heard as well. Correct? Okay.
To invest in.
Huh?
Invest.
In social media.
Now, what do you say by invest? What does that mean, so I understand?
Professional campaign.
Okay, got it.
I think the overarching message here needs to be that this requires a professional effort and a big investment, so that this is all these messages are tested, and none of this is just us here
Nice. Okay,
in this
good.
room.
Oh, I forgot about the issue about testing. That's an excellent point. Excellent. Very good. You know what I may do is actually, that would be because I like duet messaging, so I may give my talk and then I may just turn it over to you, Bob. What would be the thing you would, yeah, that'd be great. Okay. Seriously, because I'm just I'm flying by the seat of my pants right now. So, and then the next thing is, what's the next line in here? Okay. That we may, and one of the messages I think is that we probably could use healthcare workers more. We may be able to take advantage of the healthcare setting, whether people are in waiting rooms or they get the message from their physicians that you need to do this, you got to give your kids vaccinations. Yes, go ahead.
I would expand that to include dental. I would just expand it to all
Healthcare workers, yeah. Okay, got it. So next time.
We have banners that drive around every single day, and that are police cars, ambulances, and fire trucks.
Yeah.
We interact with those every day, multiple times a day. Those are some of our best.
Who knows? There might be a kind of a cool thing where everybody is, you know how we're supposed to ask people about suicide risk or something? Maybe you say, do you know how to do CPR? Yeah, that kind of thing, right? Yeah. Okay. And then one of the other things we think is that when you're doing all these things, including social media, that using good, willing subjects, people who have been through it, survivors and their families, are really a really useful tool, and we need to develop networks of people so we can always tap into those folks as needed, whether it's children or adults or whatever it might be. Yes?
Sorry to interject.
No.
Devin Clary with LifeTrack. I work for a medical helicopter service. My background, though, also includes managing a 911 center. And the gentleman in the corner.
I would never kick you out. You actually have my heart for mentioning dispatch. There are programs out there
We have
that...
a dispatch whole session on dispatch tomorrow.
Oh, I know. I signed up for it. But I just want to say I really do believe they should be added to this list because not everybody throughout our country is emergency medical dispatch trained. And if they do go through that training, no, they're not a bystander, but they are the closest thing that we have to a bystander, to teach them to calm down, break through the hysteria threshold, and talk them through hands-only CPR until the fire trucks, the police cars, and those things get there. So thank you for bringing that up.
Okay, good. So, and then we will have like a whole session on that tomorrow, so which is good. So I guess anything else anybody would add to this before we head out?
I would just add that as
right now.
I would add that as a weakness.
What's the weakness?
Not all dispatchers are trained in telephone CPR.
Okay. But is that part of the public messaging?
To her point, I think it is a strength to include them, and I think it's the fact that not all are able to do that is a notable weakness.
To the next slide that we went over really fast. Can we go to the next slide for a second?
Actually, before you do, Dr. Pepe, can you go back and you just remind your thought if you can do it linear on that last part of patients, survivors, and advocates? The testimony of survivors.
Yeah.
There's more than a communication tool. This is the groundswell where things move. I wonder if you could modify instead of testimony and use of tools. This is testimony in action. That's the groundswell where things go.
Testimony in action, is that the language?
This is testimony / action.
Oh,
this is
okay.
the CEO of the Fortune 500 country who had the cardiac arrest and is now back at work wondering what to
Right.
do with this country. That's the piece. There's more than a communication tool.
Got
It's testimony in action.
Okay.
And I think it's got a bit more of a strength. And I'm sorry to interrupt, sir.
Okay, Bob, go ahead.
That was good. I'm sorry. So the next slide we went over sort of fast, which was what other organizations, and he mentioned that it's like the NFL. We need a power organization that we connect with, a visible power organization. When there started to be pink things around the pink socks on the football players and stuff, it has an enormous impact. There's a lot of families in front of. So, and I would think basketball. There's a lot of basketball players that have gone down with quote unquote in the last 2 weeks. There have been 2 or 3 major basketball players or former basketball players that they mentioned on the news died of, during the finals. They mentioned, so and so died from a sudden massive heart attack. He died of sudden cardiac arrest.
Right.
And to get them connected, especially when knowing the prolonged QT, I don't know if they want to mention that prolonged QT, but in one way or another, getting one or another of these large groups, baseball, whatever, some group that a lot of people sit around and watch would be an incredibly powerful tool.
No, we absolutely agree with what we said before, like NFL and pink or whatever. So, okay. All right, so does it sound like we have sort of at least a working thing? And it's not going to be perfect today. I just wanted to make sure we get home with some general message we can say. And I think what I'm hearing here is that this emphasizes why the collaborative is so important, so we can have a unified messaging here that we do. Yes?
All of a sudden matter so much more
Words
than they
matter,
ever did.
okay.
This word testimony, I think the word is advocacy, because that implies telling your story and advocating. And I think she made she made a very good point about having training for your advocates.
Mm-hmm.
So is that what you wanted me to say?
Yeah, the weakness is that we're not training our advocates.
Right, so they get up and they tell their story, and it's compelling and it's moving and it humanizes it, but it also we need to train them so that they are speaking.
So one of our weaknesses is that we haven't trained our advocates, and we need to basically be part of that. Yeah. Yep. Yep. Motivate. Okay. One last thing, and I think we got to wrap it or whatever, right? Aren't we supposed to tie it up right now? Yeah. I don't think I have to anymore. I just did. Say that again?
I wouldn't close. I'm Janet Steinkamp. I'm from Take Heart America. I wouldn't close the door on our folks who've lost loved ones to cardiac arrest, because they can equally advocate, and I think that's important.
You're absolutely right.
And the other thing I want to say is I really liked the point about the sprinters and marathoners here, and that a lot of what we're talking about here today now is sprinting, the short term, but the sustainable R&D. So when we talk about social media, I really think there are some new tools that are coming up that our kids know about that we don't even know the names of yet.
Right.
So somebody needs to be watching and monitoring social media and keeping up with it. We're trying to catch up 10 years. Same with all of this. We need an R&D component, I think.
Okay. We need Pokemon on the go finding the AED.
No, I have an idea about that.
Okay.
I think we need to be talking to toy makers about focus groups and how do we integrate the reality of saving somebody with cardiac arrest technology into the toy industry. And I'm not suggesting that kids play with AEDs. I'm suggesting that in those little doctor kits, why isn't there an AED?
No.
I'm suggesting that concept and that we start talking.
What's an AED? Oh, defibrillator. Yeah. Okay, got it. Huh? Okay.
And integrating that into our everyday activities.
I mean, the other cultural change would be actually getting to TV, motion picture industries, but actually have them do it right.
Yeah.
And say the right message. It'll never happen, but.
No, it can't.
Well, and then make sure that the movies and the TV people actually do it right. It's always so goofy. Yeah. Yeah. All right.
Ads in movie houses.
Okay.
We started that in Minnesota. A quick in between.
Yeah. Well, I think we're supposed to be back in this room at 5:10, and you're welcome to stay here or go out and keep talking. And that's it. So thank you very much, and I hope I do you well in the get out there. If not, we'll link everybody's backing us up. Okay.